Did you attend a meeting sometime in February 2020 that was attended by a number of consultants, one of which is the subject of the Medical Council complaint at the moment, where experimental techniques and the use of the metal rods that you referenced earlier, and indeed the spring-assisted techniques that have also been mentioned. Did you attend a meeting in 2020, sometime in February, where these issues were discussed?
In relation to this, I'm just conscious that CHI is not in a position to actually name the individuals, and we need to be very careful because they're in the HR process.
I didn't name them. I've asked, did you attend a meeting?
Yes, I did attend a meeting, and in relation to that, and I know you've shared with me the emails in relation to that, it was in relation to a different system. Because at the time, and I'm prepared to talk about this because it's not related to the investigation that's underway, and I can't and I don't want to be to preclude any outcome of any investigation, and everybody's entitled to, obviously, to fair processes here. We had a field notice at the time about magic rods. They're a separate growing system. The field notice came to the orthopaedic consultants first and then to the hospitals. And I had a discussion about magic rods, which are separate instruments. And you'll see with the further communication, I am talking about magic rods. They're a separate
and I see that, but I suppose the question I'm asking so that we have absolute clarity, because there's lots of information now that is coming into the public domain, that from your perspective, because obviously there will be an external review, I'm simply asking you the question that the issues that you discussed, including the high-risk techniques and use of the metal rods, that you are not involved in any discussion at any point on those issues in terms of their use at formal meetings.
Yeah, so I can say I have meetings all the time with clinicians and we talk about innovation, and that's normal. We're very supportive in Children's Health Ireland.
But these are high risk, as you pointed. I'm asking you that issue of high risk and those metal rods, were you involved in any discussions in relation to that issue?
Deputy, I'm prepared to say that I was involved in discussions about magic rods because I was very clearly aware of the field notice around magic rods.
But you mentioned in your opening statement metal rods and high risk. I'm asking you in relation to that issue. Were you involved in any discussions with clinicians and others at any point on that issue? You raised, that's the terminology you used.
And that is subject to an investigation of which we will fully cooperate.
But you're not answering the question whether you had involved in any meeting on those issues, which for me is really important, fundamentally important.
I've been clear, Deputy Cullinane, if I may, that I was involved in a meeting around magic rods, which are a separate magic rods, because of a result of a field notice.
And you can say no to me. I've asked you a question in relation to the issues that you raised about the use of metal rods and the high-risk nature of them, and whether or not that was also something that you discussed or were part of discussing in formal meetings. You can't tell me no. I've asked you 4 times now. You still haven't said no. Categorically, I was not.
Because, Deputy, that is part, if it's in relation to the devices, which are non-medical grade devices, that is part of an investigation, and I'm absolutely willing to partake in that investigation, and I will answer all the questions through that process.
I'm not satisfied with those responses at all. I have enough. Were the springs procured through Children's Health Ireland? And if they were procured through Children's Health Ireland, were they procured directly by a consultant or by somebody else?
Deputy, I'm really trying to be helpful here, but that is going to be part of the investigation, and I cannot actually disclose that.
You can.
As part
you
of
can disclose it. With respect, you can, because I'm asking issues that are matters of fact. It was either procured formally through CHI or it was not. That doesn't prejudice anything. That's a matter of fact.
What I can say, Deputy President, is that we have evidence of it being invoiced, but that doesn't mean it's been procured. There are different processes.
So you can't find any paper trail?
So that is all going to be part of the review. And if I may, Deputy, I think it's really important that I correct the record in relation to the instance. When we have a high-risk surgery, we have incidents. They occur and we investigate them. If every surgeon that has an incident from a high-risk surgery was to be investigated and things sent to the Minister, that we would be doing that on a regular basis. This is our world. I think it's really important to understand that the instance it's a normal amount of our practice. We have these serious incidents, we have these complications, and we investigate them. there was a cumulative effect here that resulted in us actually communicating about our concerns. And it has to do, you're absolutely right, the second incident occurred and the concerns were raised by the staff. It is then that we said we wanted to escalate this as a patient safety issue.
I just need to just make one final point if I can, Chair, if I can.
The witness finished. Go on.
So I wouldn't like it to be known that, we responded and we acted as soon as we were aware that there was concerns and issues here. And we always have done it in relation to patient safety at the centre of what we do.
And I think that would be a matter of judgment, and people can form their own conclusions. You've given your view, I've given my view, but I just have to come back to this issue of procurement. You said that there was an invoice. I just find it extraordinary that even today we can't be told whether those springs, which you have very strongly said, and rightly so, that they should never have been used, that you still can't tell us today whether they were sourced and procured by a consultant directly or by others, and whether it was formally procured through Children's Health Ireland.
Yeah.
That makes no sense to anybody in this room.
And Deputy, I appreciate you didn't actually name the consultant, but you are talking about an employee who are engaged in a HR process. So I cannot. It would be
Well, it's in his interest as well that question is answered.